steroid therapy, which includes steroids, and bone marrow such stem cell transplant. Blood transfusions are safe common procedures in which blood is given to you through an IV in one of your blood vessels. Blood transfusions are done to replace blood loss after surgery or if the body cannot make blood properly. During a blood transfusion means small needle is used to insert an IV line into one of your blood vessels. This line will give you healthy blood. The procedure usually takes 24 hours depending on how much blood you need. Corticosteroid therapy includes prescription steroid medication. The prescription steroid that you will receive will be either prednisone or prednisone. These steroids make your bone marrow create red blood cells. The goal of steroid therapy is to allow the patient's bone marrow to make a sufficient amount of red blood cells to ensure the patient maintains a hemoglobin level of 9 or higher. Hemoglobin is a red protein responsible for transporting oxygen in the blood organs. When starting a steroid trial, the patient is typically started on a dose of steroids that is equivalent of approximately 2 milligrams of medication per quart of the patient's weight. Initially, this is split between a morning and evening dose. The morning dose of steroids that the patient will receive will be only half what they need. The evening dose of steroids gives the patient other half what they need. In the patient response to steroids, there is usually an increase in the hemoglobin count within 2 to 4 weeks. After a blood transfusion is done, steroids are considered the first line of medical treatment. Some patients are eventually able to stop completely without redevelopment of anemia. Standard reimbursement. Bone marrow stem cell transplants are an expensive and potentially dangerous procedure that can lead to death or severe chronic illness in some cases. For this reason, it typically is not a first-line treatment. Other treatments such as steroid medicine, corticosteroid therapy, and blood transfusion therapy can be used first. If possible, before deciding to have a transplant, people with DBA should discuss the pros and cons of this procedure with their medical team. After transplant, until the new marrow has started to grow, the number of white blood cells is low and the immune system is very weak. During this time, the body is susceptible to infection, sometimes from the bacteria that live in the patient's own body. Therefore, infections that normally would not be harmful can be very serious and patients can die from them. Bacterial, viral, and fungal infections are also seen following stem cell transplant. For stem cell transplant, the patient receives chemotherapy and occasionally radiation therapy to destroy a patient's unhealthy stem cells. This is called a pre-operative regimen. Some side effects such as nausea, vomiting, fatigue, loss of appetite, mouth sores, hair loss, and skin rashes may be due to the pre-operative regimen. Blood transfusion reactions are commonly caused by receiving blood. The most common cause is an allergic reaction. Allergic reactions may cause itching, hives, or rash, and rarely may be associated with swelling, coughing, wheezing, and difficulty breathing. If these reactions occur, doctor will recommend taking medicine before each transfusion. Another potentially serious type of problem may occur up to 2 days after the transfusion. Call the doctor for the following: fever, rash, back pain, butt hardness, or skin that is pale or has a yellow color to it. These symptoms might suggest hemolysis, a form of rapid breakdown of the donated blood in the body for a delayed transfusion reaction. One of the risks of corticosteroid therapy is that 83% of patients are initially responsive to steroids. 16% of patients are not responsive to the initial steroids, and may require transfusions. And 2% of patients are patients can have allergic reactions to steroids, which can cause breathing difficulties, swelling, stent syndrome, weak bones, and the greatest risk that bone marrow stem cell transplants have is heart failure. Heart failure happens when the patient's immune system attacks the new stem cells from the donor. This happens because the patient's immune system thinks the new cells are harmful and need to be destroyed. If the immune system lives to fight, the old stem cells will attack, along with the DBA, which can be done. Some more common long-term risks of stem cell transplants include infertility, the inability to produce children, and cataracts, clouding of the lens of the eye, which can request surgery. Less common effects include long-term damage to organs such as liver, kidney, lungs, or heart, and the occurrence of cancers. One piece of equipment that the doctors use for DBA is a port. A port is a small medical device placed under the skin and is used to give fluids from medical treatment into the bloodstream and to also draw blood from a large vein. It is accessed with a special needle. Its part include a receiver with a septum area where the needle is inserted, and catheter. The special needle used to access it is called a fiber needle. It has a 90-degree bend, so it is comfortable when in use, and it is non-foreign, which means it won't leave a hole when the needle is removed. Another piece of equipment that they use is an NG tube. An NG tube is placed in the nose and is taken up to the patient. The NG tube goes down the throat and bypasses directly to the stomach. They are used for giving medicine and for giving food. The food that you can have has to be liquefied so it can go into the syringe. The syringe is connected to the NG tube and the liquid can go down the tube and into the stomach. NG tube means that the body cannot digest anything. The liquefied food can go down the NG tube and uses an include outside the mouth. The reason why medicine is given through an NG tube and not in the mouth is because the body cannot keep any kind of food or liquid out. That being said, the patient was given medicine through the mouth and the patient was given medicine. The way that doctors diagnose people with DBA is by running blood tests, a complete blood count of TB-lights, a measure of how quickly the bone marrow is producing immature red blood cells. May help the doctor understand the cause of the disorder. They also diagnose it by doing bone marrow exams, samples of fluid, and solid portions of the bone marrow may be removed under local anesthesia, allowing the doctor to look for abnormalities, such as a lack of immature red blood cells. They also diagnose it by running other tests, including initial blood tests or genetic tests. Maybe organs will grow out, other types of anemia, or other disorders. I chose to do DBA because it took a toll on my life, and I wanted to learn more about it. When I was 4 years old, my little brother Ian was born, and by the time I was 4.5, Ian had received his first blood transfusion. Ian was only 3.5 months old when he was diagnosed with DBA and received his first blood transfusion. At the time, Ian was 2 years old and I was 7 years old. He was finally stable enough to come. One thing that I didn't really like about Ian having DBA and immunocytosis coming from Ian not symptom includes blood transfusions, corticosteroid therapy with corticosteroids, and bone marrow/stem cells